Welcome back to the WHY-O-MYO Podcast. This is Janine Steen, your host, hoping to answer your who, what, when, where, how, and why questions when it comes to myofunctional therapy. So as a parent or caregiver, how do you decide who or what type of professional you should consult with if a potential frenectomy is necessary, and who do you trust with that assessment? So it is important for a parent when looking for the appropriate provider to provide the frenectomy is for the parent to ask, or the caregiver to ask, a few questions. First question they're going to ask, whether it be of the ENT, the pediatric dentist, the oral surgeon, is do they perform frenectomies? If the answer is yes, then we will move on to the next question. If the answer is no, then your call is over. So the second question is, if they do provide frenectomies, what type of frenectomies do they do? Do they use a laser? Do they use traditional cutting? It is important to figure out which type, or to find out what type of frenectomy is that provider does utilize. The next question would be, is the provider proficient in performing both anterior and posterior tongue tie frenectomies, or are they only capable of releasing anterior tongue ties but not posterior tongue ties? The next question would be, how many laser frenectomies have they done, and how many do they typically do in a given day, or a given week, or a given month? The next question would be to ask is, how often or what percentage of their patients have to return for a revision frenectomy or revision procedure? The next question would be to ask if that provider feels comfortable identifying and potentially intervening if there are other tethered tissues that need to be released, whether it be lip tie or tethered tissue in the buccal cavity. So if that provider only feels comfortable with lingual frenectomies, but now we realize, or later on, or it has been realized that they have a potential labial frenectomy or a buccal tie, if that provider does not provide those type of frenectomies, then it means you would have to go to one provider for the lingual frenectomy and another provider for the labial or other tethered tissues release. The next question you want to ask is about infection rate and the typical turnaround time that the patient will be in discomfort post-frenectomy. The next question has to do with, is this something that's covered by my medical insurance or my dental insurance? And that answer is often no, it is not covered. However, there are a few providers that I know have been successful with putting the frenectomies through the insurance. However, it is not uncommon for some of the professionals that really specialize in all types of frenectomies not to utilize insurance and to have a pay-out-of-pocket option. The next question that a parent or guardian or caregiver should ask is, do they recommend exercises prior to the frenectomy and after the frenectomy? And do they work closely with a speech pathologist who specializes in myofunctional therapy, as that treatment or that intervention will help limit any reattachment or scar tissue from developing, and also reduce any chance of having to have the procedure revised. The next question that a parent or caregiver should ask when interviewing a practitioner for their for frenectomies is how often what age do they typically perform these frenectomies? Do they mostly do them on infants, or is it all ages? And when performing these frenectomies, what is the end goal? Is it always about the dentition? Is it about eating, latching, swallowing? Or does the provider have an understanding or a clear understanding of how this restricted frenum is impacting both articulation and swallowing? It is really important for whomever the provider is that does your frenectomy that they have an understanding of not just any myofunctional therapy program, but a myofunctional therapy program that is specific to the speech pathologist. And that type of training is really only offered when you're an employee of the Long Island Speech. Otherwise, the trainings that are offered elsewhere are not complete and often not strictly related to the speech pathologist's goal. However, it is imperative for me to mention that the myofunctional therapy training, which is called SPOT training, speech pathology oral myofunctional therapy or training for the speech pathologist only, does include having a firm understanding and the training that is offered both by the IAOM and the AOMT, as well as having a clear understanding of the earlier gurus of myofunctional therapy, for example, Daniel Garliner, as well as taking supplemental courses and having an understanding of other programs such as the Swallow Right program or the Tongue Thrust book, or some of the activities that, or I should say some of the exercises and goals that are associated with other subspecialties of speech pathology. And for example, that would include both prompt therapy, oral motor therapy, and feeding and swallowing therapy, as the frenum will have an impact on all of those as well. So it is important for that provider to have a good understanding of what the needs are of the person or the professional that is referring this patient to you or to them. If, as you're interviewing a potential provider's office, makes you feel comfortable, then the next step would be to set up a consultation. And during that consultation, you will bring with you, in our office, we send a script that says exactly what we're concerned about and what we are looking for to be evaluated. We will always defer to the medical or dental professional. However, if in disagreement with our needs, we will definitely attempt to provide more exercises and try to work with the frenum as it is. However, if we don't see improvement, we may send them back or send them for a second opinion. And when we do send them back or send them for a second opinion, it's mostly because no matter what we do or what we try, we are unable to provide the accurate range of motion for the tongue so that it is able to dissociate from the jaw, but also able to reach both the spot, where is that spot behind the top teeth or a little bit behind the upper front teeth, where the majority of the sounds are made, and also where the initiation or the beginning of a swallow comes from. If the medical professional only feels comfortable with anterior and not posterior tongue ties, then if we are concerned about a posterior tongue tie, then the evaluation for that will be moot because that provider doesn't feel comfortable with that type of revision, with that type of frenectomy. And the last question that you are going to ask, which for many parents is the most important, is how do you keep the child still? And do you use anything to calm them down or sedate them in any way? Each provider will tell you what their process is and what they will do and how the procedure will go and talk you through their procedure. And as a parent or caregiver, it will be up to you to determine not only which provider meets the majority of your concerns and needs, but also that you feel comfortable with how they sedate or restrain your child. I know for many providers that are especially working with young kids, you definitely needed to have a special way with those children and a good bedside manner. Those providers that work with infants and nursing mothers, you want to make sure that there's a place that they can attempt to nurse immediately following the frenectomy right in that provider's office, so that we know right then and there, or you know right then and there, if they need to release more of the tethered tissue under the tongue, or if what has been released is already satisfactory and allowing the child to latch better or nurse better, or manipulate a nipple of a bottle better. If you have a child that has special needs, whether it be Down syndrome or a child that is on the spectrum, that will be one more question that you're going to ask or want to ask the provider is, how do they perform frenectomies on individuals that have some of these conditions, or and how often are they doing them? Are they familiar with how to manage those situations or manage those disorders? And do they feel comfortable with their policy and procedures when working with a patient that may not be able to understand cognitively what is being asked of them or what's going to be done? As a parent of someone with special needs, this is very sensitive to that parent, especially because it takes a very special type of human to understand the differences and the symptoms of different disorders and how a procedure will interact when it comes to that type of disorders, associated symptoms or behaviors.